While healthcare reform is written and signed here in Washington, D.C., it will become reality out in the states, and we're joined now from the states, from Jackson, Mississippi, by Governor Haley Barbour, and Pennsylvania Governor Ed Rendell joins us from Baltimore. Gentlemen, welcome to This Week.
Thank you, Jake.
Nice to be here, Jake.
Just by way of clarification, Governor Barbour supports suing the Obama administration and the Congress for the new health care reform law. He believes that it is unconstitutional, the provision that requires everyone to get health insurance. His state attorney general is a Democrat, and it's unclear whether or not he's going to go forward. Governor Rendell, Democrat from Pennsylvania, is in the opposite position. He opposes a suit, and his Republican attorney general in that state is going forward with a lawsuit. Governor Barbour, I'd like to start with you. As you know, a lot of legal experts think that this lawsuit is folly. We asked the former Solicitor General for President Ronald Reagan, Charles Freed, what he thought about this lawsuit, and here's what he had to say.
Anybody who proposes something like this is either ignorant, I mean deeply ignorant, or just grandstanding in a preposterous way. It is simply a political ploy, and a pathetic one at that.
Governor Barbour, I think that's stronger than even Governor Rendell would say. What is your response to the former Solicitor General for Ronald Reagan?
The Solicitor General that needs to quit sugarcoating it. Now, the fact of the matter is, this is an issue that's under our Constitution, where the powers of the federal government are limited. Does the federal government have the power and authority to require, force every citizen to buy a product? In this case, health insurance. And in this case, it's not only you must buy a product called health insurance, you must buy a product that has been approved by the United States government, and the price of that product will be fixed by the United States government. I do not believe the United States government has a right, has the authority or power to force us to purchase health insurance any more than in the name of Homeland Security they could force every American to have to buy a gun.
Governor Rendell, your response?
Well, the Solicitor General is absolutely right. This is a frivolous lawsuit. It's a waste of taxpayers' dollars at a time when all the states are fighting to preserve those dollars. Look, the Commerce Clause says you can not only regulate interstate activity, you can regulate intrastate activity when it's part of a broad scheme and it's necessary to do so. Look, the only way health insurance companies, and by the way, this is not a government takeover. We left the private health insurance companies intact. The only way they can afford to give coverage to people with pre-existing conditions, people who get sick, college kids up to 26 who are staying with their parents. The only way they can afford to do that is if everyone goes into the insurance pool. It's easily within the power of the federal government. These lawsuits are frivolous.
So, Governor Rendell, I want to ask you a question. One side effect of expanding insurance coverage to so many millions of Americans at once is that the system is unprepared for it. There simply aren't the doctors. There simply isn't the infrastructure. And in fact, after Massachusetts passed its health care bill, new patients now have to wait 44 days to see a primary care physician, and only 44% of internists are accepting new patients. How are you going to sell that to Pennsylvanians?
Well, first of all, there's a phase-in. The mandate doesn't occur right away, as you know, Jake, so there's a phase-in and there's time to build up, number one. Number two, an important part of this bill is increasing payments under Medicaid to primary care physicians. We're going to create more primary care physicians, and in this bill, we're also empowering nurses. A certified nurse practitioner can do a lot of the things that a primary care physician can do. So the phase-in was very important here. There are some things that happen right away, some benefits. No kids can get denied for pre-existing conditions as of September. I don't know if you read about the little kid outside of Dallas who was born with a defect and the insurance company denied coverage because he had a pre-existing condition. That stuff is over. Kids who are 26 years of age or younger living at home, like a lot of our kids are who can't get jobs, they're going to get coverage. High-risk pools, I've got 140,000 Pennsylvanians who can't get coverage now because they're seriously ill. They'll go into immediate high-risk pools. So there's a phase-in for some things, but the things that are really important in insurance reform happen very quickly.
Governor Barbour, I don't want to pick on Mississippi, but I should point out that studies indicate Mississippi is last in the nation when it comes to health care, when it comes to access, quality, costs, and outcomes. Your state ranks worst in the country for obesity, hypertension, diabetes, adult physical inactivity, low-weight birth babies. It has one of the highest rates of infant mortality. You've been governor for 6 years. I'm wondering, What's your response to critics who say that this lawsuit is probably not the best use of your time when it comes to health care for your citizens?
Well, in fact, my state has about the same percentage of people who are covered by health insurance as the nation as a whole. So the issues that you talked about are not the result of lack of health insurance. In fact, Ed mentioned some very important good things. That is allowing children to stay on their parents' health insurance until they're 26. Blue Cross Blue Shield, which writes most of the health insurance in my state, already does that. They announced 2 years ago they were not going to disqualify people from buying health insurance because of pre-existing businesses, because of pre-existing illnesses. They already do that. We already have a high-cost, a high-risk insurance pool in our state. So the problem here is some people think nothing matters unless the federal government requires it by law. Now, a lot of states, like my state, have made real progress here. Our friends in Utah, in 2 years, have more than 40,000 people on a health insurance exchange. The president wants us and demands in this policy, in this law, that we all have health insurance exchanges. We were in the process of putting one together in Mississippi, except now we won't be able to do it like Utah. We're going to have to do it more like Massachusetts, because the federal government says you not only have to have one, you got to do it the federal government's way. We don't believe that's right for every state.
Governor Rendell, you saw the numbers that I cited to Valerie Jarrett. 50% of the American people oppose this bill, 46% support in today's Washington Post. The latest Franklin and Marshall poll from your state says that Pennsylvanians view President Obama, more of them unfavorably than favorably for the first time. No offense, you're not doing much better. Democrats in the Keystone State have a tough road ahead of them. Doesn't this bill hurt their chances in November?
No, I think as the months roll by, it'll actually help our chances. As more and more people get to understand what's in this bill, people are going to like it. As someone who's got a 25-year-old daughter at home who can't get health care coverage understands that they can right now, they're going to like the bill. When someone has a child who gets ill in September and all of a sudden the insurance company can't deny them coverage, they're going to like the bill. Small businesses under 25 employees, they can file for tax credits that will help them substantially now. They're going to like the bill. So as all of these benefits roll out, Jake, it's going to change public perception of the bill and of the president himself. And look, no one's kidding themselves. It's a tough year for incumbents, whether it's the president of the United States, it's the governor, it's mayors. It's a tough year for incumbents. When the economy's bad, that's always the case. But this bill is going to be like Social Security and Medicare that were demonized when they were passed, but later went on to be a godsend to American seniors. And I think you will find that that's what this will happen as we roll out. And I think losses in November are going to be a lot less than most of the prognosticators are foretelling.
Governor Barbour, there was some good news for Democrats in the Washington Post poll that I wanted to ask you about. And it does suggest that maybe the party, according to some critics, miscalculated, both in terms of policy by walking away. There aren't as many Republican ideas in the bill, and politics. Just listen to these numbers. In February, on the generic ballot, Republicans led Democrats 48% to 45%. But now, after the bill has passed, the Democrat leads 48% to 44%. Doesn't that suggest that maybe your party miscalculated, both in terms of the fact that the law is now the law of the land, and probably, let's not kid ourselves, it will be for a long, long time, and in terms of the politics, in terms of the fact that this is not hurting Democrats as much as you thought it would?
Well, in fact, I think Ed has got it just backwards. You mentioned Valerie Jarrett. We've now learned that big corporations are going to have to take $14 billion worth of write-offs, according to the Towers-Watson estimate. $14 billion worth of write-offs that nobody knew about. And that's how many jobs are those $14 billion of losses on corporate balance sheets? How many jobs are they going to cost? We're going to learn a lot more about this deal. We're learning already where they said small businesses who didn't cover their employees would have to pay $750 per employee. Now, it turns out when you read the bill, if you have the average employee in Mississippi who makes $32,000 a year, if the cost of health insurance is more than $3,000 for that employee. The small business has to pay $3,000, not $750, 4 times as much. As people find out these sorts of things, this bill is going to become even more unpopular. And candidly, I am surprised that the numbers in the Washington Post poll weren't better. I mean, since this thing passed last weekend, we have seen the longest wet kiss in political history given to the Obama administration by the liberal media elite, and every day it goes by, it gets sloppier.
Governor Rendell, we only...
I don't know what Haley watches. I don't know what channels Haley watches, but that's a lousy wet kiss, boy, because it's getting pounded in the media. A lot of the media is pounding the bill.
We only have a couple minutes, but Governor Rendell, go ahead.
The bottom line is Haley only talks about the things that turn out to be surprising on the negative side. There are a lot of terrific things on the positive side, as Valerie Jarrett so aptly put it. And we're finding out in states, there are a lot of good things in the states here, things that help us financially as well as the things that cause us extra burdens. So look, there is a lot to learn about this bill. But on balance, the CBO, which the Republicans depend on, say it's good for the country, it's going to cut the federal deficit, it's going to bend back the healthcare cost curve, and just think of all of the Mississippians and Pennsylvanians who are going to get coverage that didn't have it, who aren't going to get denied because they have a previous condition, who can't get dropped. These are great things. It's a step forward for America like none we've seen in the last decade.
Okay, we only have a couple minutes left, and I would be sued for journalistic malpractice if I didn't ask you two political animals a couple political questions that don't necessarily have to do with health care reform. Governor Rendell, I'll start with you. Your colleague, David Patterson from New York, it's hard to look at his gubernatorialship right now and think it's anything but a disaster and hurting Democrats in New York and perhaps even nationwide. Should he resign?
No, first of all, Andrew Cuomo is going to get elected governor of New York, regardless of anything that's going on, because he's a great public servant. But Dave Patterson's got, like I do, about 8 or 9 months left, and I think there'd be more havoc if he stepped down. The lieutenant governor right now wasn't elected. David Patterson and the people around him, I think, are okay to finish the term.
Governor Patterson wasn't elected either, but moving on to Governor Barbour, I'll ask you a question.
He was elected lieutenant governor. He was elected lieutenant governor.
Okay, fair enough. Governor Barbour, very, very quickly, does the continued presence in the Senate of David Vitter, your former colleague from Louisiana, and John Ensign, does that hurt your party's ability to claim the mantle of family values, and does it hurt your ability to tar the Democrats as being part of a culture of scandal?
Well, I'll just say to you, I think David Vitter will be reelected this year by the people of Louisiana because he's a good, solid conservative who votes the positions that people in Louisiana want. I'm not as close to Nevada, but Senator Ensign's not up this year anyway. I can't help, though, but not go back to something that Governor Rendell said. And Ed and I are good friends, seriously. But the idea that CBO has scored this bill to say that it's going to reduce the deficit is one of the things that the news media has helped the administration cover up.
Okay.
In the next few weeks, the Congress is going to pass a law that increases by $230 billion what we pay physicians under Medicare.
Governor, I'm sorry.
Everybody knows it's going to happen, and but with it, this is not a deficit-reducing health care bill, and people ought to tell the facts about it.
Governor Barbour, Governor Rendell, that's all the time we have. We're over time, in fact. Thank you so much for joining us.